This week we're going to start a series when we talk about hip mobility, hip function, and we're going to progress this into some single leg activities and then double leg activities. Okay, so the first thing we want to make sure that you can do before you start getting into any kind of lunging activity or things like that is, can you even balance on one leg? Okay, so we start off with just a timing. Okay, so see, Nancy's pretty wobbly there. Typically I start people out with about 15 to 20 seconds and progress them up to 30 seconds. And then once we can stand on one leg for 30 seconds, then I start adding in some kind of dynamic component. Okay, so the very first one, we just go in the sagittal plane. She's gonna bring her leg forward and then backwards. And just back behind me, good. And all this while, we wanna make sure she keeps upright posture. You know, we don't want to be leaning backwards and forward to move. You wanna be staying balanced. And with that, you have them raise the foot to the level that they can maintain control. Okay, so you don't want them swinging the leg out and then stumbling to try to catch up with that. Okay, the second one we do is abduction and adduction. So now she's going to stand on that leg and she's going to be bringing her foot out to the side. Okay, now on this one of the things you want to do is make sure that they're lifting their ankle, not their toes. Oftentimes, one of the faults you see, turn your foot out as you're coming up, turn it out. Right here, okay, that recruits other muscles here in the hip. We want to keep everything nice and tight here where we're just using the glutes and then also maintaining that balance on the other side, okay? And then the third range of motion we do on this one is in the transverse plane, where we just have them tap and then swing back around and tap behind. Okay, so now we have that vertical pivoting on the hip, okay? All right, so yeah, so Nancy's got some things we can work on there, okay? And then so some of the most common faults you see with this also is the drop hip, okay? So go ahead and show them what we have drop hip looking like. So her leg up side is actually down lower than her support side, okay? So that tells us that she's not recruiting her hip muscles enough. You want to try to concentrate on contracting here, pushing the heel into the ground and maintaining the hips level. The other version or compensation is over. Okay, so now she's hiking the hip up to try to do her activity here. Okay, so now she's over recruiting on this side to compensate for a weakness on this side. So those are the two major faults that you're going to see on any kind of single leg balance. So when you start working with somebody and you want to get into the single leg activities, this is a good place to start. Okay, things that translate into activities. If you've got weak, the tensor fasciae latae is the muscle that's on the side. If those muscles are weak, when you're doing your strides on running, you're going to have those drop hips or overcompensations. Those translate into knee and ankle issues later on down the road.